guys, I'm a little uncomfortable doing this. This is not what I normally do, but this is something that I've been thinking about for a really long time because I've been going through some interesting injuries for 3 years and I've been unable to get diagnosis, and I've gone through a lot, and I just really feel like my experience can benefit people that might be going through similar things. I've looked to YouTube, I've looked to social media in a lot of different situations to try and find the guidance that I need, and I have come across some videos that have been super helpful for me. So I guess what I'm trying to do is get out what I've learned in case it can benefit anyone out there. This all started when we're kind of in the middle of moving to a bunch of different places. My husband's in the military, and so we were in San Antonio, and we were about to move to a small town in New Mexico just for a few months for his training. And when we were in San Antonio, I started having this strange pain, like at my lower abdominals and in my groin area, I guess. And I wasn't sure what it was. And so I went to the doctor. The doctors immediately were like, oh, well, let's check your reproductive system. So I got the ultrasound like 2 days before we left San Antonio. And then I got the results driving to Alamogordo. I remember I was in my car by myself. We drove separately because we're in 2 separate cars. And I got the results. And I like have all my journals of this whole experience. And this is what I wrote down. I got the phone call I've been waiting for patiently with my ultrasound results. They said nothing was wrong and everything was normal. Now you would think I'd be so happy about this, but I was disappointed. I thought they would tell me what's wrong so I could start feeling better, but no, I felt invalidated. Kind of how when you fall, you almost want a bruise to prove you're not a baby, but that it really did hurt. I now felt like nobody believed me, and I really was in pain. For some reason, this made me feel really sad. That was after 1 week. Like, I was already freaking out, and it was 1 week of pain. Fast forward 3 years, and I'm here doing this video. That just gives you an idea how long this process has been. Insane. So we got to Alamogordo, New Mexico, and I started going to a doctor there. He felt in the area, and I coughed, and he's like, nah, you don't have a hernia. Okay, then why do I have pain? And he said, well, you probably just have inflamed tendons and ligaments. And oh, okay, huge part of this story. I had pneumonia in 2016 and 2017. I was coughing insanely hard for 3 to 4 months. And then that's when this pain started happening. This deep abdominal achiness started happening. And so this hernia doctor was like, yeah, you probably just sprained some of your muscles from coughing so hard when you had pneumonia. And so they sent me to physical therapy. This was the beginning of physical therapy nonstop. I've been in physical therapy for 3 years. The doctor of physical therapy, he also didn't really know what he was doing. Keep in mind, I'm in a really small town, so I wasn't getting the best healthcare. He started saying I had hip problems, and then because my abdominals were hurting, my back started hurting, and then he said I had a slip disc in my back, and I was constantly icing myself, and it just got worse and worse and worse and worse, and I was like, what is happening? And as somebody who's such an active person, I'm a dancer, I work out every day before this, I was going absolutely mad. So when it was time to leave New Mexico, we then moved to Las Vegas, Nevada. And when we got to Las Vegas, I was so excited because I thought, yes, I get to go see a bunch of new doctors, a bunch of maybe better doctors, and see if they're able to give me a diagnosis. So I started seeing the doctors here, and once again, they didn't really know. And I started going to physical therapy here, and they were calling me their mystery patient, and they couldn't figure out what on earth was causing me pain and why it wouldn't go away if I rested or if I did physical therapy, and nothing seemed to work. So I started doing what's called prolotherapy, which is where they inject a saline fluid into the area. It makes it really inflamed, which is supposedly supposed to encourage blood flow, which will then cause it to heal. So after the prolotherapy was finished and basically the doctor said, well, I don't know what else to do with you, I sort of just started to accept the new reality that I had, that I was just going to be a person who was in chronic pain. A few months after accepting it, I was just crying to my husband and I was like, why can't anybody figure out what is causing this? This can't be normal. There seems like something that can be fixed. And so we were like, okay, what could we do? Let's see a hip specialist. We had to change my insurance so I could go off base and see a different, more specialized doctor. So once I saw this doctor, they did an MRI of my hip. By the way, this is the third MRI that I had had, but what they did differently is they injected it with ink deep into my hip joint so that they could see the labrum. And what they found in my left hip, which is the one that I always said was worse, was a torn labrum. So why this gets confusing, why did this go from being a low abdominal pain to being a hip pain? It kind of happened over the course of all my physical therapy. They just kept saying, well, true hip pain actually does occur in that kind of low abdominal groin region. So this could be a hip issue. So looking back, it's really hard to tell how much the hip played a role and how much the abdominals were playing a role. But what I do know is I did have a torn labrum in my hip, and that's something that required surgery. This was the first time anyone had given me any answer after 2 years. So I was like, yes. And I signed up. I was like, let's go. I got surgery like 3 weeks later. And dang, this recovery is intense. I was on crutches. I was in the grocery store like riding in little chairs so that I could get around. What was strange about my recovery is I didn't seem to have that pain go away. And I have so many people like in the Facebook groups and stuff that I'm on for the hip labral tear that were like, as soon as I got the surgery, I could tell like it was better. It was different. Even though I had to recover, the achiness was gone. It felt different. And for me, I was like, nah, I feel the same. And it was so hard for me to tell if this had even done anything. So that went into a very frustrating recovery experience for me. Kept getting beat down, beat down, beat down. This groin pain kept coming back. So I go back to my hip doctor and they didn't have a ton of insight for me. They're like, well, have you checked to make sure you don't have endometriosis? So I was like, okay, I'll go get it checked one more time just to rule it out. And when I went there, the doctor, he shared something that was actually very helpful for me. He said, in women, if you have groin pain, there's kind of an order of events that they diagnose things. First, they check your reproductive system because more often than not, it's going to be endometriosis or cramps or something that has to do with that area of your body. Second, they check your digestive system because there's so much packed into that area and your digestive system is part of it. And then lastly is when they check muscles, tendons, soft tissue injuries. So that's why I've been put through the loop, and that just made so much sense to me. So once I started to realize, okay, this is definitely a soft tissue injury. How I knew that is because it got progressively worse if I was active. If I was even laughing or talking a lot, it would get a lot worse. If I was sitting for a long period of time, it would get worse. And it wasn't something that changed like with my period or really with my eating habits, like something in the reproductive or digestive system might. And I started doing research on my own and I came across Athletic Pubalgia or sports hernia. And I started reading it and I was like, this is me. This is totally what I have. Athletic pubalgia is a soft tissue injury that is in your abdominals. So your abdominals all connect onto your pubic bone, and this is when they start to tear away from the pubic bone. It's also called a sports hernia because it has a lot of the same symptoms as a hernia, but you don't have an actual bulge that a typical hernia doctor would find, just like my experience that I had in Alamogordo. So that's why it's been so hard to diagnose. Another really important thing to understand is that athletic pubalgia is super uncommon in women. That's why it was the last thing that they checked on me. And I looked it up, it's actually only 3 to 14% of all sports hernia diagnoses are to women. The rest of the 75% is all men. So that's been another thing I've had to deal with, convincing people that yes, I understand, I'm a woman, I'm not a football player, and I still have this injury. And that's something that you definitely have to fight for. Then I went to my orthopedic and I was like, hey, I think I have this thing called Athletic Pubalgia. And they were like, I highly doubt it. I highly doubt it. And I said, could I request an MRI to check? And they were like, okay, yeah, let's do it. Because they had seen the frustration I've been going through. So I requested an MRI with an Athletic Pubalgia protocol. And with that, they also checked to make sure that my hip was okay. So sure enough, I get the MRI and I had a mild case of athletic pubalgia. So since my case was a mild case, they said, you won't need surgery, you can just do physical therapy. Then I made it a goal to find somebody who knew about this injury who could be my physical therapist and specialize in this. Where I lived in Las Vegas, I couldn't find anybody who was specialized in this particular injury. So I was once again stuck. I did physical therapy for 6 months and I saw no improvements. My pain actually got worse. So the crazy thing about this injury is when you have like torn abdominal muscles, your body compensates because you need your core to support your body. So I started having that back pain that I talked about earlier came back. Both sides started hurting really badly. I started getting pain up higher into my ribs, but mostly just that pain in the area was what was lingering and never went away. All these other symptoms would kind of come and go. So I did a bunch of research. I joined a Facebook group page for this injury, a support group, which if you have any type of injury or symptom, see if there's a Facebook group for it, because that's been so helpful for me. I was on the Labral tear hip Facebook group, and now I'm on the Athletic Pubalgia support group. And in those groups, you find people going through similar situations. You can ask questions and get the answers that you're looking for. So in that group, I started seeing people talking about these doctors, one in Philadelphia and one in California. So what I did is I sent my MRI to Philadelphia and to California, and then I was communicating with these doctors. Pretty much, I finally felt understood for the first time in many years. They were like, oh yeah, you have athletic pubalgia, you probably will need surgery because it's been going on for so long and physical therapy hasn't worked and all of these things haven't worked, so yes, we see you, we validate you, this is definitely what's happening and we can help you. So I flew out to California, I saw the doctor there. I felt like he didn't look at me as a whole being. He didn't look at my hip and the hip's involvement in all of this. And that's why I've made the decision to fly out to Philadelphia to see the other doctor. They have a hip specialist and an athletic pubalgia specialist so that you can get a diagnosis that it incorporates all of the different intricacies of whatever injury you're dealing with. They do all new imaging. I'll meet with the hip doctor, I'll meet with the athletic pubalgia, core, muscle surgeon doctor, and they're going to come up with a plan, and ultimately I will get surgery. So that is my story. That's 3 years of experience to get a diagnosis. I have 3 takeaways from this experience. First is do your research. You are the only person who understands what you're feeling in your body, and you're the only person who knows the quality of it, where it's at, and all these things. So get on the internet, do some Google searches, find people on YouTube who are talking about it, find support groups on Facebook, and try and figure out what's going on in your body. Number 2, advocate for your health. Doctors might not care too much, whereas this means everything to you. So you're the person who has to go in, show your research, show them, I think this is what's happening to me, and do your best to get them to understand why you think that and to help you get the correct diagnosis. Number 3, trust what you're feeling. A lot of times people make it seem like, oh, it's all in your head, or it's emotional, or you're imagining it. Trust the feelings that you're feeling. And the way that I was able to trust this was by keeping a symptom tracker log where every day I write down what I felt, what activities I did, what services I had done, if I had acupuncture, massage, physical therapy, what helped, what didn't help. And all of these things were proof that, okay, I'm not imagining this. I have days and days and days and days and days of data that are exactly the same. Once you truly believe what is happening is really happening, then you can start advocating for yourself, and then you can get the treatment you need, and then you can ultimately heal. So I hope you guys enjoyed this video. Thank you so much for watching. I hope it can be of some service to you and to give you some help so that you can get the correct diagnosis that you need. Thanks.